السلام عليكم ورحمة الله وبركاته. Patients in the Middle East complaining that many hospitals are not providing the healthcare service efficiently. Many patients complain that the time they spent in the hospital for getting for receiving their medical service is not as they're happy to provide. Also, many patients complain that the service is taking more than other hospitals outside the Middle East. Hospitals in the Middle East are slowed down because of waste, because of errors, because of additional loads which are considered waste. A typical environment for a hospital is high stress, also high variety, high volume, high speed, and also high turnover in nature. So this is a typical environment for mistakes, for errors, for problems which can happen to the patients, which is very dangerous in the healthcare profession. The CEOs and hospital managers are concerned about two questions. The first question is everything happening to the patient which should be happening in my hospital? The second question is there anything happening to the patients in my hospital which should not be happening to them? Lean Six Sigma is a 100-year-old methodology. It was provided in the industry, and also then moved to training, to service, and now moved also to the medical sector in many countries. In Sweden, in a Swedish hospital, they discovered after implementing Lean Six Sigma that 65% of the paid surgeon time was wasted for waiting for the preparation of the surgery room. In the USA, a 200-bed typical hospital is estimated an additional cost of $500,000 because of failures in the management system and management process and administrative process. An Asian hospital discovered that about 80% of the nursing calls from inpatients in the hospital are actually housekeeping natures. In a Middle Eastern hospital, after implementing Lean Six Sigma, discovered that the average time between the discharge signature of the doctor and also the actual time leaving the hospital is about 6 hours average time due to administrative and protocols and procedures. In the Middle East, they discovered that an average waiting time for the nurse at the elevator for each service they provide to each patient is about 6 minutes. So we need to implement a Lean Six Sigma in your hospital very soon to reduce the waste and also to solve the problems and also to streamline the process. Six Sigma or Lean Six Sigma is based on 3 pillars. The first pillar is respect for people, respect the patients, respect the staff, and respect the suppliers. And then the second one is continuous improvement in your service, in your process, in everything. And then the third one is problem solving. Go to the root cause of the problem. Find the root cause of the problem through Six Sigma, the MIC process. After attending the Lean Six Sigma for hospitals and healthcare professions course, your staff will be consultants, will turn into consultant, into cost killers. They will not only learn how to reduce the cost, reduce the inventory of medical supplies, they will also increase the efficiency of the service. They will learn how to discover waste in the process from the view of the patient experience. they will have an idea how to manage and how to monitor processes and how to eliminate waste. They will focus on voice of the customer or voice of the patient instead of the voice of the process. You will have a common language. You will have a common methodology. You will have a philosophy. You will have a benchmark. You will use the Six Sigma table as a KPI of your operations, of your departments. So I hope if you are a healthcare profession, if you're working in a hospital, if you are working in hospital management, if you are a doctor, if you are a dentist, if you are a nurse, if you are a lab technician, if you work in a hospital, so this Lean Six Sigma for hospital and healthcare profession is the right course for you. And I'm your trainer. My name is Hasni Kazim. I am from Jeddah, and I hope to see you soon in the next course of Lean Six Sigma for hospital and healthcare professional. Wish you all good luck and a good service to your patients. Assalamu alaikum wa rahmatullah.